Folks, thanks for coming on with us today. My name is John Dubas with Premier Marketing. We'll be spending the next hour or so discussing how we approach selling Medicare health products, specifically looking at the full spectrum of options that our prospects and clients have by selling both Medicare Advantage and Medicare Supplement plans. As a bit of housekeeping, keep in mind that today's presentation is being recorded, and the link to that recording along with the PowerPoint to the presentation and much of the material that we'll reference through the course of today's presentation will be sent to all who have RSVP'd to today's webinar. We will also make certain that you receive some of the additional handouts that come with the webinar itself, and sometimes these being sent to a large number of individuals blind copied as a document can sometimes push this into your spam filter. So I ask that if you would, please check that, and we'll make certain that you receive all the data that we have available to you. If you also notice in today's software, there is a section for questions, and if you would, please utilize that section so we can make certain that we are accomplishing everything that we need to. And hopefully, I've got a couple of people that are having some challenges with the phone number to access the audio to today's webinar. Hopefully that's being resolved by either trying a different attempt at a telephone call or rechecking to see if you haven't perhaps transposed a couple of numbers in that phone number and the other ways of accessing that audio. A bit of information about Premier Marketing to put us all kind of on a level set. We are a national marketing organization founded in 1968. We are part of the Integrity Marketing Platform with offices across the country. We do act as an insurance wholesaler, offering insurance products to the public through independent insurance agents such as yourself. And the contracts that we offer are at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means recently we celebrated a milestone in our history, our 50th anniversary, which is a grand accomplishment, I think, for what began as a small family agency in rural Nebraska that's become one of the largest marketing organizations of its type in the Medicare and ancillary space. We do so through a full insurance portfolio that includes the Medicare Advantage and Medicare Supplement programs and the standalone Part D prescription drug plans. We also offer a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, and long and short-term care products, in addition to disability income plans. We also offer a full gambit of ancillary benefits, including dental, vision, and hearing plans, critical illness and cancer programs, and hospital indemnity programs. Those Medicare Advantage carriers include all the national carriers and many of these strong regional carriers that can make a difference for you in your market, with that philosophy carrying over to the standalone Part D prescription drug programs as well, where the national carriers are available to you through our organization. Our Medicare Supplement portfolio is very large and robust, includes a number of new entries into the space that are being very well received. The CVS Ascendo program and the Humana Achieve programs particularly come to mind. We have a number of different assistance programs that can make this space a very viable way for you to add to your book of business and to your agency profile. When we look at the ancillary products in the different categories, all those national carriers are there for you and are available to you through our organization. These are unique products in the fact that they can be a very valid way of addressing additional needs your prospects and clients have, but also are a great way to drive up the persistency with your book of business and a great way to introduce additional revenue streams to your agency. When we look at the Medicare market opportunity and we look at the opportunity to offer healthcare programs across the gambit of the folks that are within our purview, it's important to note that if we look at just the number of people turning 65, it's an awesome market. It's a huge market. It's also one that if you look at it just by the number of people turning 65, you're well aware of the silver tsunami, the 10,000 people a day turning 65, one every 10 seconds. But you're not seeing the entire outlook of the Medicare opportunity, because there are some folks that will not access their Medicare benefits immediately upon turning the age 65. And there's a good portion of the Medicare population that aren't 65. They're accessing their Medicare benefits because of a disability, and it's almost a sixth of the Medicare population. And when you look at this particular slide and the information lent to us by Kaiser Family Foundation, we see that it makes a difference, this age barrier, obviously, and a lot of it may have to do with the fact that folks under the age of 65 don't have access to the full range of the Medicare product offered in the Medicare Supplement arena, even post-MACRA, as some of the folks over the age of 65. So it behooves us to have a strong portfolio of product to address the needs of all the people that we visit with, because it's a challenged market. 2/3 of the population have 3+ chronic conditions, so you may have underwriting challenges or other monies that have come out of that particular pocketbook that makes it difficult to have a full gambit of choices. Because as we see here too, we have folks that are also challenged with their income and their assets. And in many times this will influence the choice of an individual as to the program that they select moving forward for their health care. Very varied population. It's all over the country. We see that we have 16% of the Medicare population under the age of 65, 12% 85 or older. And you have a big gulf in between. So it's important that we have details on our market that we're approaching, not just the folks that are in it, but also the product that is available to us through the market that we are active in, and make certain that we can address the needs of our prospects and clients. Because let's face it, as a person becomes eligible for Medicare, they're faced with a challenge of a number of different choices. First one is, do I do anything at all? They don't have to. They don't have to pick up the Part B coverage. They don't have to pick up any coverage for prescription drugs, but those choices will make ramifications for them down the road, and is something that we need to be aware of as we go through and look at the choices that they have, because they may suffer penalties for enrolling in one type of coverage or another later than when they were first eligible. They also have the choice of staying with original Medicare and adding additional coverages to help with the costs that they have. Obviously, that's something that is a big indicator as to where people go, in the fact that there are advantages to a Medicare Supplement program versus a Medicare Advantage plan in network that may be overcome by dollars in other areas. So we look at a population that not only has a simple choice to make, do I make the first step, but they also then have to decide, much as we do as agents, what programs may best fit their situation. Do they want to pay a premium and have a standardized Medicare Supplement program, or do they want to explore the options they have with Medicare Advantage plans, which bundle the different coverages for them, and many times has a low or no premium for the plans that they offer? Well, let's look at some of the reasons why they may do what they do. Well, some of those folks who came in to Medicare came in at different times, is what we saw earlier in the presentation, where the people that are first accessing Medicare, so that's beyond the agents, those are also the folks that are late to Medicare, picking up Medicare, we're seeing nearly an even split between Medicare Advantage and Med Sup programs. We also have a portion of folks that don't appear to take a choice at all. We have to look beyond the veil here a little bit, look beyond the curtain and say, hey there, wizard, what's with the 17% of people and what's influencing the choices between 41 and 43? Well, those 17%, those might be people with retiree coverage that don't need one or the other. They may be veterans who are accessing care through the Veterans Administration. They may be folks who made the decision not to make a decision, and that was a decision. So some different things that we need to be aware of and realize that part of our function is to help educate people as to the choices so they can take care of the inevitable costs that come into play. And we can see that that will vary, as I mentioned before, between the 65 and older and those younger than 65. Much of that may be dictated by the fact that the under 65 population doesn't have the full gambit of Medicare supplement choices in most instances, and the Medicare Advantage programs are available to them without a difference in the benefits that are offered. So what do we do when we come to a situation where we're basically becoming a mentor of sorts? We're doing a Medicare 101 with the folks we visit with. Hopefully that is what we're doing, and we're prefacing that by some different compliance actions, but we want to make certain that we are making folks aware of the good, the bad, and the ugly of whatever choice they have to make available. And part of that may be helping them just understand what the heck those acronyms are. So these programs are available to you as part of the follow-up to today's presentation upon your request, because they're large documents, but they give you a translation of those acronyms and help you better explain the choices that folks have. So when we look at one of the first choices we have, and what's Medicare Supplement insurance, Medigap, these are private insurance companies offering coverage for folks for healthcare costs that original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Many of these also offer coverage for services original Medicare doesn't cover, like medical care when the individual is traveling. And it's important to note that this is an individual choice based on each person. So a husband and wife, that's two choices to demonstrate which coverage they want to take on as part of their ongoing recognition that the original Medicare doesn't cover everything. So what this program does is it bases its premiums and its benefits on what Medicare does. So if Medicare covers a service and it is approved as a Medicare approved amount and is part of the covered benefits under the Medicare Supplement plan type, then the Medigap policy will pay its share. These programs are different than original Medicare itself, and they are different than a Medicare Advantage plan. It's most important that we don't call a Medicare Advantage plan a Medicare Supplement plan, because it's not. These plans are ways to get the Medicare benefits as fully covered as possible, and Medicare policies available as a Medigap only supplements the original Medicare benefit. In order to pick up a Medicare supplement policy, the beneficiary must have Medicare Part A and B, and if it is an individual who has an opportunity to change coverages, they must make certain that the underlying requirements are taken care of before that individual tries to sign up for the other program. These are plans where the private insurance company charges a monthly premium for that policy, in addition to the other premiums that are charged for the base coverages. So that Part B premium that is $144.90 for everyone who is under the IRMA limits, those Part B premiums need to be paid as well. And once again, this is an individual choice. So husband and wives can choose the same program or different policies as well. It's important to note that you can buy a Medigap policy from any insurance company that's licensed in the state to sell one. And these standardized Medigap policies are guaranteed renewable even if you, as a beneficiary, have health problems. This means the insurance company can't cancel the Medigap policy as long as you pay the premium. Some of the Medigap policies sold in the past did cover prescription drug programs. The Medigap policies sold after January 1st, 2006, weren't allowed to include prescription drug coverage after that time period, the modernization time period. If you want prescription drug coverage, that's a necessity that is satisfied by picking a Medicare prescription drug plan, a standalone Part D plan by itself. And it's important to note that it's illegal for anyone to sell you a Medigap policy if you have an MSA plan as well. So different things that come into play with the purchase of a Medicare Supplement plan. These programs were standardized back in 1992. I remember visiting with my grandmother prior to that. She had 4 Med Supp programs. After they were standardized, you had just a possibility of one, and those benefits were laid out in the different supplement plan types, A through N. This was required so the plan comparison could be easier, and so that the benefit structures would not change after someone already had a specific plan. So it's important to note that a G plan is a G plan is a G plan. There may be some extra benefits thereafter, but the basic benefits are all the same. So what we have as well is a kind of step back from that if you live in certain states, because the majority of states are standardized in the same fashion, but in Massachusetts, Minnesota, and Wisconsin, Medigap policies are standardized in a different way. So if you are an agent in one of those states or you market in one of those states, that requires some additional information for you in that circumstance. It's important to note that while each insurance company decides which Medigap policies it wants to sell, certain state laws may affect which ones they offer. Insurance companies that sell Medigap policies don't have to offer every Medigap plan that's out there. They must offer a Medigap plan A if they offer any Medigap policy in the state, and they must also offer a plan C or F if they offer any plan that is now augmented by some changes through MACRA, where additional policies are now guarantee issue as well. That legislation I keep referring to actually passed back in 2015, the Medicare Access and CHIP Reauthorization Act, and the part that influences a lot of what we do as insurance agents comes into play at the beginning of this year, so 5 years after the legislation came into place. So what you've got is basically a couple of subsets of beneficiaries in the Medicare market. And these are individuals that can no longer access plans F, C, or high deductible plan F if they're newly active in Medicare after the first of the year. Those that were already on Medicare prior to 2020, they can select or switch from any plans at any time in the future. So those plans did not go away. They just are not an option for the newly involved Medicare beneficiary. So it's important to note also that for these new people, the Plan F is not only going away as an option, but the high deductible Plan F is also unavailable for those individuals. So this gives you an idea of how the Medicare supplements now actually look for the people that we visit with on a year-over-year basis. It is the layout of the standard plans and then the differentiation of the C's and the F's for those that hadn't had Medicare prior to the first of the year. These programs will vary from company to company and from plan to plan, from state to state, zip code to zip code for that matter. It's up to the insurance company to decide how it sets the price or the premium for its policies. And it's important to note how the company prices its policies. The way they set the price depends upon how much the individual pays now and in the future. There are 3 ways for a Medigap policy to be priced or rated. The first is community rated, which is also no age rated. The issue age rated, which is also called entry age rated, and the attained age rated individuals. So you can see by some of the language how that price can change as an individual ages as they go through life. There are also differences as to how you can get a Medicare supplement plan without underwriting. And so some of the things we need to make certain that we do is differentiate between open enrollment and guarantee issue. Open enrollment is a one-time only 6-month period when federal law allows the individual to buy any Medigap policy that you want that's sold in that particular state. It starts in the first month that you're covered under Medicare Part B and you're 65 or older. So those folks that have accessed Medicare benefits before the age of 65 because of disability will also have this open enrollment period as they turn 65. During this time period, the beneficiary cannot be denied a Medigap policy or charged more due to past or present health conditions. Some states may have additional open enrollment rights under state law. There are a number of states that are birthday states. So in the month that you have a birthday, you have an opportunity to change coverage. That's not widely available and only in certain states. When you look at the guarantee issue rights, these are rights that you have in certain situations, like if the individual loses the other health care coverage, or insurance companies are required by law, where insurance companies are required by law to sell or offer a Medigap policies. In these situations, an insurance company can't deny a Medigap policy or place conditions on that Medigap policy, such as exclusions for pre-existing conditions or charge you more for a Medigap policy because of a past or present health program. So 2 very important time periods that we need to be aware of, and be aware of the differences between the 2. If an individual is outside of that open enrollment period and are applying for Medigap policy, there's no guarantee the insurance company will sell that Medigap policy if the Medicare medical underwriting requirements are not met, unless one is eligible for those special situations. There are also available in certain states another type of Medigap policy, which is called Medicare Select. This is a purchase of a Medigap policy where you have the right to change your mind within 12 months and switch to a standard Medigap policy. So it's not like you have that reduced time period where you can turn the policy back. It's also important to note that in many circumstances, one insurance company may underwrite differently than another. So we need to make certain we are aware of how certain medical conditions or prescriptions or even activities would prohibit an individual from purchasing one Medigap policy or another. If a person's looking to switch Medigap policies, there are some valid reasons to do so. You might be paying more for benefits you don't need. You might need more benefits than you needed originally. And you may have the right policy, but you want to look at different insurance companies for one reason or another. And your current policy may have the right benefits, but you want to shop to see if there's a policy that's less expensive. There are ways that we have with our quote engines that help you as an agent not only identify the carriers you need as part of your portfolio, but also offer a Medicare Supplement review through the use of that program. So you've got different times when you can switch. That includes that free look period that I referenced before, where the Medicare Supplement, Medicare Select programs had 12 months for that free look. In this circumstance, it's 30 days. It's important to make certain that the coverages are in place before anything is canceled, because you never know what happens with your body. Some of the things we need to be very aware of that are not Medicare Supplement plans include the Medicare Advantage programs, like the HMOs, PPOs, or PFFS programs. We got to realize that the Medicare prescription drug plans aren't a Medicare supplement program either, even though they're only available through private insurance companies. Medicaid is not a Medicare supplement. The retiree or employer or union plans, or even the federal employees health benefits program are not Medicare supplements. TRICARE for life is not a Medicare supplement. Neither are the standard veterans benefits, and long-term care policies are not a Medicare supplement and are generally not a benefit with any Medicare supplement either. It's important to note too that the health coverages offered to Native Americans through the Indian Health Service, tribal and urban Indian health plans are not considered Medicare supplements. When we look at the state of Medicaid, it's important to note that we see a swing when it comes to the income and who's purchasing a whole bunch of it, particularly in urban versus rural areas, where you have in urban settings an opportunity for stronger provider networks in a network-based program, and you may also see that the benefits of Medicare Advantage programs aren't as strong in rural areas and don't have the same allure that you may see in some of the urban settings. You can also see here where across the board there are differences when it comes to the penetration of both Medicare and Medigap plans. You'll see in some of the very urban areas that they may have been in the network delivery programs longer than some of the others, and so they have a lower penetration of Medigap policies, and you may see the opposite as well, where networks may suffer a bit with Medicare Advantage plans, and so the penetration is influenced by that manner. When you look at some of the plans that were delivered before MACRA came into effect, we see that the vast majority of Medicare supplement plans were Plan Fs. And so we're going to see a large number of people that have been on Medicare prior to the first of the year that have a Plan F and still want it. This may be a valuable market for a lot of agents because when people price this coverage, it gives us an opportunity for discussion of multiple products, but it also gives us the opportunity to show through a Medicare supplement review that we can not only price compare for them with their current coverage, but see if other programs could save them even additional dollars on an overall out-of-pocket basis. You'll see also that Medicare supplements, the vast majority of them are offered by the big boys, United Healthcare, Mutual of Omaha, the CVS group, which is Aetna, the HCSC group, which is Blue Cross Blue Shield in 5 states, and then, of course, Anthem and Cigna. You get into some of the other larger names, you see the percentages start to peel off a little bit, and then you'll have a number of carriers that will compete for that business outside of the name group. So it's important to have quoting tools available so we can help explain the differences between these programs with people we visit with as well. We also see here that the policies remain into effect for a considerable amount of time. You'll see programs that may have never been reviewed, and that person is in a situation where their health circumstances and timing allows them to select another program at a savings, but many of them won't simply because they're comfortable with the path they've chosen. A large difference, and then an explanation of some of the plan changes can vary that behavior as well. So some of the things that you'll see in the Medicare and You handbook that will say what Medicare and Medicare supplements don't cover. That includes prescription drug coverages. We've discussed the PDP programs, the travel coverage or coverage outside the United States, mostly limited under Medicare to Canada and U.S. territories, and with a bit of Mexico thrown in there as well. But there are some Medicare supplements that will offer worldwide coverage travel. Once again, long and short-term care aren't covered by Medicare, and most folks find that a rather disheartening surprise when they reach Medicare age. And then, of course, most of the ancillary benefits aren't covered by Medicare either, the dental, vision, and hearing programs. When you look at the differences then between Medicare and Medigap, sometimes it might behoove us to go back and look at and realize some of the challenges that folks have in getting reasonable coverage based on their budget, based on their health circumstances, and based on their individual prerogatives, their choices. Because some of the big differences, well, the Medicare Supplement insurance plans are not network-based and allow the beneficiary to select doctors and hospitals and other providers as long as they accept Medicare patients, where in many circumstances the Medicare Advantage plans are network-based and the individual is required to use that network unless it's an emergency. In many circumstances, there are also referrals required within that network for Medicare Advantage plans where the beneficiary can see a specialist without referrals with a Medicare Supplement plan. So that kind of goes into the discussion we had just about the network restrictions. Medicare Supplement plans generally don't have them unless you got a Medicare Supplement plan that's hospital only, where much of the Medicare Advantage plans do have network restrictions, and it's something we need to look at. We also need to be aware of the enrollment process and the differences not only in enrolling, but in marketing to the folks that want different types of programs. When you look at a Medicare Supplement plan, that's that 6-month period after the individual turns 65 and joins Part B, where they have that guarantee issue period. When you look at Medicare Advantage programs, when a person is aging in, it's 3 months prior, the month of, and 3 months after the birth date month, where you have that guarantee issue opportunity, or pardon me, that enrollment opportunity. And then you also have special election programs that may allow a avenue for a person to change plans as well. When you look at the cost, the Medicare Supplement programs, you pay a monthly premium for them in addition to the Part B premium. And when you use the services that are delivered under the Medicare program, the out-of-pocket costs are limited or waylaid completely depending upon the type of plan that you take. When you look at a Medicare Advantage plan, generally they are offered with a low or zero premium on a monthly basis in addition to that Part B premium. But as the individual uses services, they have co-payments, co-insurance, and deductibles. It's important to note that Medicare alone does not have a maximum out-of-pocket limit, where Medicare Advantage plans do. And we may see some changes in that from 2020 to 2021 based on additional services being delivered through a Medicare Advantage plan as opposed to how they were delivered in the past for ESRD. It's also important to note that prescription drug coverage is not part of most Medicare Supplement plans, any of them being purchased after the modernization practice where the J plan was gone. Now, for new people, it's important to note that this coverage is not included as part of the Medicare Supplement plan, and that the individual needs to look at the Medicare Part D plan offered by private insurance companies to make certain that that coverage would be available to them, particularly without penalty down the road. When you look at the Medicare Advantage programs, the majority of them have the prescription drug coverage integrated in with the benefits that they offer in addition to that. When you look at choosing Medicare Advantage plans, it's important to note that these are similar to private health insurance, and most services require a small copayment. Plans may be based on a number of different network chassis, including health maintenance organizations or preferred provider organizations, and this can make a difference as to what a person has to pay under one of these programs. These programs have different benefits and different rules. Each of the companies can set up their own way of doing business for the most part, and Most include that prescription drug benefit, as we mentioned before, integrated into the program. Most of these programs do require a referral. They're not open access to see a specialist. Well, some don't require it. Some may require that the individual pay a portion of the out-of-network care if they're in a PPO program or an HMO POS program, while others will cover it completely. So there are all a number of different reasons outside of just dollars as to why someone would look at a Medicare Advantage plan versus a Medicare Supplement plan. It's also important to note that we need to go beyond just some of the stated copays to determine the total cost of a plan in the Medicare Advantage arena, because many of them may have ancillary benefits that are of additional economic value, but there may also be certain plans that will require different out-of-pocket expenditures based on hospital stays and the procedures outside of hospital, and some of the well person benefits as well. What we're seeing over the last couple of years is the introduction of many benefits that are more non-medical, and we see them applied more in a specific type of Medicare Advantage plan we'll address in a little bit. But what we're seeing here is more of a variety of some of the assistance on different programs than you will see on most Medicare Supplement plans. To be able to enroll in one of these programs, the consumer must be eligible, or entitled to Part A and enrolled in Medicare Part B. They also have to, I'm looking at this and I changed one of the wrong lines. Instead of the qualifying for Medicaid assistance, that's for a dual SNP program. This is a requirement where an individual has to reside in the service area where the plan is being offered. And the only health condition this year that would keep a person out of these programs, they're not medically underwritten, is having end-stage renal disease. There are certain chronic special needs programs that cover these ESRD challenges in certain markets, but they're not widely available. That's something we'd have to look up on a case-by-case basis. What we're seeing is a number of factors that are influencing the folks that are enrolling into Medicare Advantage plans. You'll see in many circumstances minorities enrolling in Medicare Advantage plans, part of that being a perception that these are cheaper than a Medigap plan. Some circumstances they may be, and some they may not. And so you're seeing an allure of that type. You're also seeing more females enroll in these programs than in Medicare Supplement plans. That may be for multiple reasons. They perhaps may be recently widowed and weren't tasked with writing checks. They may also be the folks that, well, hey, women outlive men. They may be older, and this is the more viable option for them on an economic basis. And you'll see that older people may also choose a Medicare Advantage plan more frequently than a Medigap policy, simply because of the premium that comes into play. May be a very valid factor, or it may be a person who's possibly outlived their savings. So some different pieces that come into play that we need to be aware of. We'll see on this that Medicare Advantage enrollment is constantly growing, and we're seeing a little bit of decline with the standalone Part D programs that might be as simple of a diagnosis that the Medicare Supplement program, which requires a Medicare standalone Part D program to get that coverage, that may be something that then comes into play later in life, and we have to be aware of the costs that come with it. These are the folks that in a recent notification from the government, we see the largest MA organizations that come into play. You'll notice in many circumstances, a lot of these folks are the same folks that we saw in the largest producers for Medicare Supplement programs as well. That doesn't mean necessarily the contract is one or the same. Some of these companies will offer a standalone contract for the Med Supp versus the MA or PDP program, but it gives you an idea of the real players that are in that market. You'll also note that in an examination of the largest producers in the MA market, that a number of them are getting a ton of their enrollments because of group coverage. You also see Medicare Supplement folks getting enrollments from group coverage. It's just that generally the enrollment percentage is not this market. Steady uphill stream. As we age into Medicare, you've got folks looking at different coverages. The Medicare Advantage program is on a continual upstream, and we look forward to that continuing in the future as well. This gives you an idea when we striking back to some of the pieces that we talked about with older people and the monies that are available and who's buying what with what. This gives you an idea of the fact that even though some folks may be higher income, they may still be choosing a Medicare Advantage program. And you'll notice in many circumstances, well, 20% of them, 1 in 5, between $10,000 and $20,000, there's a good percentage of folks that are still picking Medicare fee-for-service programs. It's one of the reasons we emphasize the need to be aware of the differences between the two and the advantages and disadvantages of each of them as you speak to your prospects and clients. It's not always tied to the wallet, but that's a general indicator in many circumstances. You'll see, however, when you look at different statistics that are spawned by race and ethnicity, that there's not a huge difference between that as an indicator as to what a person chooses. You have also additional special needs programs under the Medicare program that I referenced a little bit ago. These are programs that are designed specifically with folks with certain diseases or characteristics, and they tailor their benefits, provider choices, drug formularies to help accomplish that. We had a webinar on that earlier this week, and we will include a prescription, a link for these different types of programs to help you examine them as well. There are 3 different types of special needs programs based on illness, where a person lives, and if they're a dual beneficiary. By far, the largest number of folks in a plan are in a dual program. So when you look at the differences within the Medicare community, you'll see that you have a number of folks that may not be locked in because they have a chronic illness program that qualifies them for enrollment in a chronic special needs program. You will see different people that qualify for a SEP because of turning 65. We realize we still have to discuss different options with those individuals because they may be well unaware of the options that they have. And then, of course, you see that the dual beneficiaries represent 20% of the Medicare population nationwide. So while you may not be one of those folks that pursue that niche market because of the strain on their budgets, it's something to be aware of because you don't necessarily want to leave a fifth of your business behind. So what you have is a split Medicare opportunity. As Yogi Berra said, when you come to a fork in the road, take it. In order to do so, we need to be prepared with the information we have because not one size will fit all individuals. We have different ways of getting you in front of those folks. So when you look at some of the statistics that we had earlier, you'll see that many folks will choose based on their wallet, and that's all they'll see. They'll look at the premium, and that's what they're going to base a decision upon. In many circumstances then, because it is a opportunity to take advantage of a low or no cost Medicare Advantage program, it gives the individual a way of almost eliminating half of the choices that they have. Is that the proper thing to do? I don't know. When I had securities licenses and work with people in that area. One of the things that they used to tell us in getting that license was it's important not to impose more risk on an individual than they were comfortable with. So there were many people that invested based on the fact that they may not win huge, but they're not going to lose huge either. In this circumstance, it may be an individual who looks at just the bare premiums of a Part D program, the Medicare prescription drug programs, and the the medical benefits of a Medicare Supplement plan, and see that those benefits on a monthly basis are more than they can afford. If you look at that split opportunity of people coming in to the Medicare space, that's 58% of the people that aren't buying a Med Sup. That's also 60% of the people that aren't buying a MA program. So it is necessary for us to look at all the other things that make the decision for our prospects and clients. That includes not only the premiums for the programs themselves, but the out-of-pocket expenditure for them after those programs are enrolled in, but also the opportunity to fully discuss how medical coverage with prescription drugs can make a big difference as well. So that is not part of the premium of a Medicare Supplement plan. With most of the MA plans, it is, and it can give a indication of what the total medical cost for the year will be as well. And then there are some folks that just don't like someone telling them who they can see and who they can't. So network may be a big thing. I've discovered over years of experience that in many circumstances, that network importance is diminished by their doctors and hospitals being part of the network. Not so important that it's a network anymore if they have access to the people that they're seeing. It's also important to note the age of some of the providers that they're seeing, because as we age, many times our doctors are about the same age as we are, and they don't necessarily ask us when it comes time to retire or tell you to seek other care elsewhere. It's also important to note that many folks like the idea of, here's my premium, I've been in Medicare before the first of the year, I want to know that I've got a Plan F. It's going to cover every of the covered expenses under Medicare, and I don't have to worry about any out-of-pocket expenditure. So they are not betting on their health like a Medicare Advantage person does to a degree, but they're looking at total stability of the dollars coming out of their accounts. So some different things that we need to be aware of, and it's also important to note that slide here, not one size fits all, because there are people that will look for one other or two other or three other factors that make them comfortable with their coverage, and it doesn't necessarily have to deal with dollars. Some of the extra benefits we're seeing in the Medicare Advantage space are influencing many people to go that route. Others are seeing part of those added on with certain Med Sup companies in certain areas where it's legal to do so. So it's a question then of basically going in and diagnosing your prospects and clients. Much as what we see when we come into a doctor's office, they don't just give us a shot or a pill and send us on our way. They take blood samples or they do tests, they ask us a bunch of questions, and they render a diagnosis. That's much as what we see and what we do in providing the information an individual has for choices of coverage moving forward. We also do some different things to help you find these people in the Medicare space. A lot of this has been influenced by COVID-19 and the social distancing, but let's be honest. It's not going to last forever, and we're going to be back out shaking hands and kissing babies, so to speak, and utilizing a full gambit of marketing options. We have options now as well, even though some of them are based just on telephonic or electronic outreach. But it's important to note that there are also differences as to how we market these programs. You can cold call for Med Subs. You can't cold call for Medicare Advantage or prescription drug plans. So that makes a big difference as to number one. When you look at community-based marketing, however, this applies across the board for both types of coverage. For retail marketing, yeah, we're talking about right of first refusal stores in Walmart now. Those programs tend to have more traction with Medicare Advantage plans, but based on the area of the store, it may well be a very viable way of marketing additional Medicare Supplement plans as well. Faith-based venues, this is an opportunity to basically utilize centers of influence in the community that reach out to a population that may not respond to some of our other marketing outreach. And you can do so through offering different types of educational programs on a seminar or a camp basis, but it's a great way for you to deliver benefit information to folks that aren't receiving it in other fashions. And one of the other pieces that we really need to take advantage of is marketing through providers, both ways, in the fact that these folks are actually delivering upon the care that we're preaching about, and it gives them an opportunity to look at the alternatives they have. Some doctors will look at their payer mix, and that will decide how vehemently they market one program or another. There may be doctors who decide not to be part of a network, kind of like the choice we have between a Med Sup and a Medicare Advantage plan and looking at the network restrictions. There are docs out there that aren't in a network. They give us an opportunity to market with those providers with Medicare Supplement and PDP programs. So different things that we can look at, those centers of influence and other key factors in our communities that can make a difference as to the mix of products that we offer as well. Some of the carriers offer different types of marketing programs. A couple of the Medicare Supplement programs are really innovative in offering social media programs or marketing credits that you can use outside of just direct mail programs, and it can make a big difference. And some of the Medicare Advantage programs will offer assistance to agents they partner with in leads they're generating as well. So that can make a difference to you. There are also different community activities in which you can participate to help increase your visibility in the community. It's important to note that a lot of these are more long-term than a microwave type of activity, but you can still get enrollments each way. There are some programs that allow you to door knock. We see this mostly now with final expense programs. There are still some Medicare Supplement programs that will do it. If you're doing that as a Medicare Supplement representative, it's important to note that that activity is not compliant for Medicare Advantage and PDP programs. You need to be prepared to discuss where your leads came from as well. Social media is really hot right now. There's Facebook leads for final expense and Medicare that are getting some really good traction. And then we do offer direct mail support based on a production that can discount the cost of those programs in half and are a great regular type of activity for you to market. We do also offer electronic access that gives you the opportunity to look at an individual and give them some detail as to why Medicare Advantage or why Medicare Supplement based on dollar cost. This particular tool gives you the opportunity to look at the Medicare supplements that are available in your prospect's zip code. It then gives you a breakdown as to how big of a book of business that company has as well, see how they're going to maintain their benefits. It also gives you an idea as to the ratings of these programs, how practical it is to expect some of them to maintain the premiums they have in play, but it's also a way for you to go through and discuss options. And there may be circumstances where even in this system, you run into an individual that wanted a quote on a Medicare supplement plan because they wanted to get away from a network or for another reason, and they realize that it is out of their budget. but they're uncomfortable with, let's say, the daily co-payments of a Medicare Advantage plan. This tool will give you the opportunity to select that Medicare Advantage plan and add a hospital indemnity program on it based on the benefits of each and the premiums of each. And that gives you the opportunity to make certain that even if you can't change the individual's base health program for one reason or another, there is an opportunity to get them additional coverage and get additional business out of a house by using this tool. It gives you an opportunity also to send the electronic scope of appointment and store it for that mandatory 10-year period as well. Sending a scope of appointment, even if you are marketing a Medicare supplement plan, it's not a bad idea because it opens the possibility of the other types of insurance that's listed on that scope of appointment, and it opens up a doorway, a window of sorts for you to then discuss the other types of plans that are on the program. You're covering yourself for the opportunity to discuss these other programs. It gives you also an opportunity to sell electronically through an e-app process that is very simple to do. Part of what we'll do as part of the follow-up is a demonstration on how to obtain that scope of appointment electronically in the e-app as well as part of the follow-up. The other program that we offer that helps you market these programs is Medicare Center, and it gives you the opportunity to obtain that electronic scope of appointment stored as well, but also compare Medicare Advantage or prescription drug programs side by side compliantly, and then use the program to enroll the individual. So you are being more efficient, effective, and you're helping people that as they age into Medicare are more prone to shop, the opportunity to do so within the alternatives that you have within your portfolio of products. So what we've got here are two different systems that really make it easy for your prospecting client to do a comparison and then complete an enrollment process. So you're doing a couple of things here in this area that eliminates the ease of enrollment as a reason for a person to enroll in one plan or another. There are some people that will do that. Some additional things we're going to do to help you, because there are a number of plans and companies out there, you can complete an agent profile with Insurance Bay and use it and the data you're putting into it as a way to contract with multiple carriers and completing those contracts electronically. Saves you time and effort in the long run and makes it easy as you discover changes in your chosen target market. We also give you the opportunity to purchase discounted errors and admissions coverage. This is not like adding you to a blanket E&O policy for one policy and then you wonder how you cover with the rest. This is a program you own and it covers you regardless of your upline. So it's an important thing to realize that you need that coverage as an independent insurance agent, and this is a program that works very well to do so. We also help you keep your license in play with bundled discounted continuing education programs through our association with WebCE. If you are a recruiter and you're building your own agency and you're bringing in folks that aren't licensed, this program will help you get them licensed to begin with as well. And we give you the opportunity to add to your own benefit package through a modified guarantee issue, discounted, non-cancelable DI program where you're sharing in the commission as well. So it's a great way to protect your income as an independent agent. Much as we're going through and recording this presentation as well, we have other recordings on different training programs that we've done that help you with not only specific marketing initiatives, but also with an opportunity to learn more about specific carriers and the programs that they offer. There's nearly over 100 of these now. They are posted on our website at premiersmi.com and on our YouTube channel and we have them available for you as well on a singular sheet for you to go through and peruse and see what might be helpful for you. Since many of the carriers do offer additional incentives for some of their production, you got to realize that when you're looking at Medicare Advantage versus Medicare Supplements, you won't see that with Medicare Advantage or PDP programs. Their compensation is dictated by the government and set by the government as to a maximum, where Medicare Supplements are not handled the same way. They don't have that same requirement here either, so they may have additional incentive programs, a marketing program per app, ways of doing covering costs and different marketing campaigns, and we have them all listed in this particular area for you as well. Since those Medicare Supplement programs are open to additional compensation, they will also help you qualify for the Premier Producers Convention, which this year was to be a cruise from Miami to the Bahamas. COVID-19 changed a lot of plans for a lot of people and changed that as well. So some things that we can help you with. Additionally, we talked about some of these different lead sources that are available to you, the discount you get through direct mail support, and an opportunity to do business with you. There are folks that will choose one segment of the Medicare population to market versus another. The folks that have higher income have an opportunity or the wherewithal in many circumstances to purchase additional programs more easily than some of the folks that might be financially stressed. However, there may be people that offer you a greater opportunity to sell in multitude by offering Medicare Advantage programs and setting yourself up as a market expert in different areas in a different market that may enable you to make more money that way as well. What we see in many circumstances are Medicare Advantage programs that have a lifetime renewal on those programs. So as long as the plan stays in place, you get a renewal income. There are fewer Medicare Supplements that offer that same sort of commissionable structure. Many of them are now moving into lifetime renewals. Some of the lifetime renewals on the latter end of the policy get a little thin. But it's an opportunity for us to look at, in your chosen market, here are carriers in both bundles. Which are the more reasonable opening stanzas to take care of people, and how can we work to earn that business together? Because a lot of times folks see the lovely stuff on top, they don't see all the hard work you went through in order to be as successful as you are. So, realizing in many circumstances that we need both types of plans, we need to determine what would be your best selection in a particular market. We can do so through our use of the quote engines that we have, through the CMS Medicare.gov Plan Finder, different ways of determining these are carriers that are important for you in your market. You put them in play, you put them as part of your overall marketing plan, and you would not believe the flexibility it gives you to work cross-selling these programs, cross-prospecting as well. All that said and done, you can reach any of us here at Premier to get additional details on Medicare product in your market. Call us at 1-800-365-8208. Speak with your marketer. They can go through a process to make certain that you have the programs you need to be successful throughout the Medicare spectrum. You can also get information through our website at premiersmi.com, and we welcome the opportunity to visit with you about the choices that you have. You have spent your most valuable resource with us, a little over an hour of your time. We want to make certain that this pays off for you and give you suggestions as to what valued next steps may well be. All that said and done, we appreciate that investment in your time. We look forward to visiting with you in the very near future. And in the meantime, we wish you good selling. Thanks so much. We'll talk to you soon.